Well, traumatic brain injuries are a leading cause of death and disability in the U.S., affecting millions of Americans each year. But new research suggests that the most severe cases may not be the death sentence that they once thought to be. Mandy Gaither explains how updated treatment guidelines could help save more lives.
It's called a penetrating traumatic brain injury and can be caused by gunshot wounds, stabbings, falls, or accidents involving sharp objects.
There's sometimes been a view that if someone's got a penetrating brain injury, it's a very severe injury, and that a lot of those patients can't be salvaged.
Dr. Gregory Harlock with Cleveland Clinic is senior author of these updated Brain Trauma Foundation guidelines aimed at saving the lives of those with some of the most severe penetrating brain injuries. He says this is the first change in decades to the recommendations for doctors on how to care for these patients.
In the military, a lot of patients are shot with very high caliber military weaponry, much more powerful things than we tend to see in a civilian hospital. But the reality is those patients actually have better outcomes.
The updated guidelines take cues from the military. Harlock says first, with this type of injury, doctors should screen and aggressively treat brain lesions, which are areas of the brain with damaged tissue. But he says that treatment should be a less invasive approach called endovascular surgery, which uses catheters to reach and repair damaged blood vessels. Finally, during the first surgery after injury, he says doctors should plug the wound to prevent fluid that surrounds the brain and spinal cord from leaking so that bacteria can't get in.
Recognizing that a lot of these patients can do well with aggressive care, I think that's probably the most important part.
For Health Minute, I'm Mandy Gaither.